Ani, my name is Naandwechige-Gamig, and I am your Aboriginal Diabetes Initiative Program Worker here at the Wukumikong Health Center. Today, I'd like to do a quick intro to diabetes. So, like a lot of people that may kind of know or are curious or would like to find out, let's just do a quick overview. So what is diabetes? Diabetes is a disease in which your body either can't produce insulin or cannot use the insulin it produces properly. Insulin is a hormone produced by your pancreas. Your pancreas is an organ located behind the lower part of your stomach, in front of your spine, and plays an important part in diabetes. The pancreas is an organ in which it produces insulin, one of the main hormones that helps us to regulate our blood glucose or our blood sugar levels. Your body needs insulin in order to use the sugar for energy. There are 4 types of diabetes. We have pre-diabetes, gestational diabetes, type 1 and type 2. There are 11 million Canadians presently that are living with diabetes. Chances are diabetes affects you or someone you may know. The first one of the type of diabetes are pre-diabetes. Pre-diabetes is a condition where your blood sugar levels are slightly higher than the normal range, between 4 and 6, but are not high enough to be considered a type 2 diabetic. Not everyone with pre-diabetes will develop type 2 diabetes, but unfortunately, many people will. It is very important to know if you have pre-diabetes. Almost 6 million Canadians have this type. Research has shown that some long-term complications with diabetes, such as heart disease, may begin during this stage of pre-diabetes. Taking steps now to improve your lifestyle can make a huge difference and can lead to a healthier future. Getting active, starting with a 10-minute walk 3 times a week, and eventually challenging yourself and beating that said goal. Looking at your meals, adding more vegetables, cooking more homemade meals, taking good for lunch, choosing whole grains, drinking more water instead of pop and juices, and switching from a dinner plate to a saucer so it's more portion controlled. The second type of diabetes we are going to talk about is gestational. Gestational diabetes is a type of diabetes that happens during the 2nd or 3rd trimester of pregnancy. Between 3 and 20% of pregnant women develop gestational diabetes, and depending on their risk factors. In most women with gestational diabetes, they did not have diabetes before their pregnancy. However, after giving birth, the diabetes usually goes away. During the 24 to 28 weeks into pregnancy, diabetes can be diagnosed by a blood test. Women who are at higher risk of type 2 diabetes should be screened at 20 weeks of pregnancy. During gestational diabetes, your body cannot produce enough insulin to handle the effects of a growing baby and all the changing hormone levels. High blood sugars during pregnancy can result in problems for you and your baby. 1, preeclampsia, which is the high blood pressure. Abnormal sugar levels in baby. Your baby can grow too large, increasing your need for cesarean. And possible birth injuries due to the baby's size and difficulties during delivery. You may have a higher risk of health problems later in life, such as type 2 diabetes and heart disease. You can reduce the risk of developing gestational diabetes by managing your weight, eating healthy, and staying active during your pregnancy. The third type we will touch on is type 1 diabetes. Type 1 diabetes is a disease in which your pancreas no longer produces insulin. Our bodies produce sugar, and we also get it from foods we eat, like bread, potatoes, rice, pasta, milk, and fruit. Without insulin, sugar builds up in your blood instead of being used up for energy. Type 1 diabetes is not caused by eating too much sugar and is not preventable. This occurs when the body's immune system destroys the cells that make insulin. This type can develop quickly and is diagnosed in childhood and early adulthood, but it can happen at any age. You can manage your type 1 diabetes by taking your recommended insulin prescribed by your doctor, monitoring your blood sugar levels regularly, eating healthy meals and snacks, aiming for a healthy body weight through regular physical activity and eating well, managing your stress, quit smoking, and regular visits with your healthcare team. You can live a long and healthy life by taking your insulin and keeping your blood sugar levels at a range set by your healthcare providers. The fourth and final type of diabetes is most common, type 2 diabetes. Type 2 diabetes is a disease in which your body cannot produce enough insulin, or your body does not properly use the insulin that it makes. Because of this, sugar builds up in your blood instead of being used for energy. If left unmanaged, the extra sugar in your body can eventually cause problems and can lead to serious health complications. A lot of people don't have any symptoms, which means some people can live with type 2 diabetes for years and without knowing it. You can manage your type 2 diabetes by eating healthy meals and snacks, regular physical activity, monitoring your blood sugar with your blood sugar machine, aiming for a healthy body weight, taking your diabetes medication prescribed to you by your doctor, managing stress, quit smoking, and taking care of your overall health, head to toe. You may feel isolated, overwhelmed at times, but with management and a good healthcare team, you are not alone. Type 2 diabetes can be totally manageable. With diabetes, there are many diabetes complications that can and may happen if left uncontrolled, or you decide to ignore your disease. Eye damage. Many people living with diabetes have some form of eye damage or diabetic retinopathy, also known as diabetic eye disease. Diabetic retinopathy can lead to vision changes or blindness. Typically, it presents no symptoms during the early stages, not until there is a noticeable change. With blood sugar control, regular eye exams, and early treatment, the risk or worsening of eye damage can be reduced. Having too much sugar in your blood can damage the blood vessels in the part of the eye called the retina. The retina is the tissue lining the back of the eye. High sugar levels can cause the blood vessels to swell and leak into the retina, which causes blurred vision or blind spots. If left untreated, new blood vessels may grow and cause further damage to your vision. You can get an eye exam once a year unless your ophthalmologist or optometrist has suggested something different. The risk of vision loss can be greatly reduced with regular checkups. Remember, you may not be aware of changes to your vision, and many problems can be treated when caught early. Understanding diabetic neuropathy. High blood sugar levels over an extended period of time can damage the nerves that go to your arms, hands, legs, and feet. Diabetic neuropathy increases the risk of foot ulcers and amputations. People with diabetes that have nerve damage in their feet and toes often don't notice minor cuts, sores, or blisters in these areas. If left untreated, these small wounds can easily become infected, lead to gangrene, and may eventually require amputation. You are more likely to have diabetic neuropathy or nerve damage if you smoke, have high blood sugar levels, excess body weight, and high triglycerides, a type of fat in your blood. Nerve damage can cause symptoms in different parts of your body. The most common symptoms are usually sensations in the toes and feet, such as sharp and shooting pains, burning, tingling, a feeling of being picked by pins, and throbbing. Although there is no cure, there are many ways you can effectively manage or delay diabetic neuropathy. Take proper care of your feet, keeping your blood sugar levels in target, and getting your feet checked regularly. If you already have signs of nerve damage, it is important to examine and care for your feet on a regular basis. This will help you notice and treat issues before they cause you more harm. Examine your feet and legs daily for cuts and sores. Care for your nails regularly. Apply lotion to your feet if they are dry, but not in between your toes. Wearing proper fitting shoes. And testing your bath water with your hand or elbow before stepping in to make sure it's not too hot. Heart disease and stroke. Diabetes increases your risk of heart disease and stroke. People with diabetes may develop heart disease 15 years earlier than those without diabetes. High blood sugar is one risk factor for heart attack or stroke, but people with diabetes often have a number of other factors: overweight, inactivity, high blood pressure, and high cholesterol. People who smoke or have a family history of heart disease or stroke are at even a higher risk. Working with your healthcare team to achieve the following targets is key to good diabetes management. Achieving and maintaining a healthy weight through regular physical activity and healthy eating is important. Your doctor should check your blood pressure at every appointment. Getting your A1C done every 3 months, and having your cholesterol checked once a year and knowing your results, and don't be afraid to ask questions. Kidney disease. Diabetes is the leading cause of kidney disease in Canada. High blood sugar levels and high blood pressure can damage the kidneys and prevent them from functioning properly or even cause them to fail completely. Kidney disease is a serious complication associated with diabetes. The kidneys are two bean-shaped organs located just below the ribs near the back. Their job is to filter the blood so that waste is removed through the urine. The kidneys also regulate the amount of fluid and salt in your body and are important in controlling blood pressure. Over time, high blood sugar levels can damage tiny blood vessels in your kidneys, which means they cannot filter the blood properly. As kidney disease progresses, waste products start to build up in your blood because your body can't get rid of them. If left untreated, your kidneys will eventually fail. This is known as end stage of renal failure, and dialysis or a kidney transplant may be required. Diabetes can also affect the nerves that tell you when your bladder is full. The pressure from your full bladder can actually damage the kidneys. If urine remains in the bladder for a long time, it can increase your risk of developing a urinary tract infection, which can spread to the bladder. Kidney disease is closely linked to high blood sugar, high blood pressure, and smoking. The best way to prevent or delay kidney damage is to keep your blood sugar and your blood pressures at target, quit smoking, taking your medication as prescribed by your doctor, having your blood cholesterol checked annually, following a healthy meal plan, exercising regularly, and talking to your doctor about getting screened.